Hearing Aids and Accessories, sponsored by Assistive Technology for Kansans and Tiny K, Kansas Infant Toddler Services.
Your baby should have a hearing screening in the first month of life. In Kansas, they're screened within 5 days of birth through our Sound Beginnings program. If hearing loss is suspected, a hearing specialist or an audiologist should follow up with a hearing test for your child within 3 months. If hearing loss is confirmed, it's important to consider assistive devices like hearing aids and communication options by 6 months of age. Today's technology makes hearing aids work for even very young babies. Hearing aids may be small, but they're pretty complicated devices. If you're a parent of a child who's going to be using a hearing aid, it's important to learn how they work so you'll know how to help them use it. There are 2 kinds of hearing aids most often recommended for young children: behind the ear hearing aids and in the ear hearing aids. This hearing aid is the behind the ear hearing aid. This is the type of hearing aid most often recommended for very young children. Children's ears grow rapidly during the first few years of life, and ear molds, this part right here that fits inside the ear, can be changed easily as the child grows in this style of hearing aid. In the ear hearing aids house the controls right within the ear mold and are easily outgrown. In the ear hearing aids are also made of a hard plastic. If an in-the-ear hearing aid is damaged while the child is playing, that hard plastic can cut the child's ear canal. This is much better for very young children. A lot of parents have difficulty keeping their baby's hearing aids in place. One thing that can help is toupee or wig tape. It's a double-sided, skin-friendly tape that can be put on the inside of the hearing aid, behind the ear, and then touched up against the child's head. It's sticky on both sides, and it will get a little bit dirty and will need to be changed fairly often. Some babies might be allergic to the adhesive, and so parents need to look for signs of any irritation around the tape. Dental floss or fishing line and a safety pin can also be helpful in keeping those hearing aids located. Just tie a piece of fishing line or dental floss around the hearing aid. And tie the other end to the safety pin. The child's hearing aid is put in place as usual, but then attach the safety pin to their clothing, so if it falls out, it's not going very far. A company named Ear Gear has created a hearing aid clip that's even snazzier looking than our dental floss and safety pin. They make it in a lot of different colors, very fashionable, and different sizes for different types of hearing aids. This Ear Gear has 2 hearing aid covers, nice bright pink. And you just simply slip them over the hearing aid. You can color coordinate these to go with your outfit. Put your ear mold on. Put your hearing aid in, and then attach this clip somewhere on the child's clothing. These are great for adults to use too when they're in sports activities. Sometimes children pass the hearing screening as infants but have later hearing problems due to middle ear infections. This happens when there's a buildup of mucus in the middle ear and it becomes infected by bacteria. This can cause earaches and muffled hearing. Most often your physician prefers to let this infection clear up by itself. The body's immune system is very good at getting rid of these kind of infections, usually after a day or 2. If your child is prone to repeated ear infections, they may want to consider a pressure equalization or PE tube. It's a tiny little tube that's inserted in the eardrum and lets the fluid drain away from the middle ear. For years, doctors cautioned children with pressure equalization tubes to stay away from water activities. More recently, some physicians have begun to suggest that swimming and bathing precautions really aren't necessary, that the water doesn't get into those tiny little tubes into the middle ear. If your doctor has recommended earplugs, you may find that Putty Buddies and ear bandits may be helpful for swimming and for bathing. Putty Buddies are a soft, comfortable silicone type earplug that can custom fit the ear canal. Here's how to use them. Tear off as much silicone as is needed, shape it into a ball, and place it over a dry ear canal. Flatten the plug with your finger and shape it to cover the outer ear until it's snugly fit. Do not force into the ear canal. Remove the plugs by pressing up on the back of the ear. The ear bandit is a headband designed to hold earplugs or ear molds in place while engaging in water activities. It's made of neoprene with an adjustable Velcro closure that comes in lots of different colors and 3 sizes. This is the smallest, and it's just right for about a 1 to 3-year-old child. Here's a tip. If your child wears a hearing aid, you may want to consider a hearing aid replacement or repair insurance plan. That really helps if they're accidentally lost or damaged. The family dog may be really attracted to your child's hearing aids. Don't leave them in a purse or on a dresser within puppy's reach.
Demonstrated by Rhonda Etter, AT Specialist, Southeast AT Access Site, Parsons, Kansas. Ear Gear, Hearing Aid Covers, www.gearforears.com. Putty Buddies, www.earbandit.com. Ear Bandits, www.earbandit.com. For questions and support, contact your AT Access Site 800-526-3648 or 800-KAN-DO-IT. Contact ATK KU staff if you would like to be involved or have suggestions for inventory. 620-421-8367. If you want to see other items like the one demonstrated, contact the ATK Device Loan System 785-827-9383. June 13th, 2010.